Concerns about being separated from baby. It is normal to feel very anxious about being away from your baby, even if you've made up your mind that you want to breastfeed whilst you're still working. There are many other decisions that can cause anxiety about being away from your baby. To find a caregiver that you can trust and that will support your decision to continue breastfeeding. To decide on and learn an effective method of milk expression. To know more about breastfeeding, for example, the factors that affect milk supply. To make a time and place for feeding your baby or expressing milk at work. To help your baby become comfortable taking feedings from the caregiver whilst you are away. Find someone that you can trust and who will listen to your concerns and acknowledge your feelings, thereby helping you to make this transition with your baby a gentle and confident one. The need to express does not go on forever. As the baby begins taking other foods, you will slowly be able to increase the time between expressions. As your baby gets older, the caregiver can feed the baby solids, whilst you and your baby can enjoy the breastfeeding relationship whenever you are together. Find support from friends or others who have experienced breastfeeding a baby and continue to work. They will help you withstand the outside pressures. How to breastfeed before going back to work. 2 weeks before returning to work, concentrate on increasing your milk supply by exclusively breastfeeding your baby. For example, short and frequent feeds 10 to 12 times in 24 hours. To introduce a bottle to your baby in order to receive the expressed milk, start 1 to 2 weeks before work by asking someone else to give the bottle in a different place to where you normally breastfeed. This could be given once a day during the usual times that you would be at work. How often to express or when pump replaces breastfeeding. This depends on how much milk is needed for the baby and how many hours you are separated from your baby. If mom is working a full day away from her baby, she would express 3 times. She would breastfeed her baby when she wakes, before she leaves the baby, express during the morning at work, a short for comfort pumping, a full pumping at lunchtime, and another short pumping in the afternoon. If you are working less than 4 hours, then you can breastfeed before work and then again when you are at home with baby. If you are working 4 to 6 hours, express once, 2 to 3 hours after each feed, therefore decreasing the feeling of fullness and making it easier for the baby to latch on later. Delaying expressing more than 4 hours can lead to engorgement, a blocked duct, or mastitis. As long as you are expressing milk, there will be a supply. Expressing in the morning is easier because of the breasts being fuller and you are feeling more rested than in the evening when your supply may be lower. Basics of expressing breast milk. Expressing and pumping are learned skills, and the effectiveness of these skills improve with practice. Factors that influence pumping. Whether you are able to stimulate your letdown or milk ejection reflex, how long it has been since you last breastfed or expressed, how practiced you are at expressing, how comfortable you are in the setting where you are expressing, the time of the day, your milk supply, stress and its effects on you, choice of nipple fittings, and the ease of use of the breast pump. Understanding the letdown reflex and expressing. The letdown can be psychologically conditioned as well as physically stimulated. For example, some mothers let down their milk when they hear a crying baby or even at the thought of their baby. Because the sensations of pumping and hand expressing are not the same as the sensations of feeding a baby, especially at first, you may need to encourage your letdown using some of the following methods of physical and psychological stimulation. Express milk in a familiar and comfortable environment. Minimize distractions, so take your phone off the hook, turn on some relaxing music, and have everything ready that you may need, such as a glass of water or juice, a nutritious snack, or something to read. Follow a pre-expression ritual. Use a rhythmic motion while expressing to mimic a baby's suck. Focus all your senses on your baby. For example, have a photo of your baby nearby, a blanket to smell, or think of your baby snuggled close to you. If you are with your baby, express with your baby close by or while you feed on the opposite side. During milk expression, stop a few times to massage the breast. Switch breasts when the flow lessens, expressing from both breasts several times during each session. The breast is never empty, unlike a bottle, and milk is being constantly produced 24 hours a day. The technique of hand expressing. Wash your hands thoroughly. The letdown can be assisted by massage stroking and leaning forward and shaking the breasts. Position the thumb and forefinger about 2 to 3 centimeters behind the nipple. Push straight into the chest. Roll the thumb and fingers forward as if making thumb and fingerprints at the same time. Repeat rhythmically. Rotate the thumb and finger position to empty all parts of the breast. To avoid damaging delicate breast tissue, be aware of not pulling, squeezing, and sliding motions while expressing. Expressing should not hurt. The technique for using a breast pump. Wash your hands thoroughly. Using a breast pump takes practice. You may need several attempts at using the pump before you feel you are confident with it. Choose a time when you are not rushed and won't be interrupted while using the pump. Make sure all equipment for expressing and storing milk is washed, rinsed, and sterilized. Correctly assemble the pump and make sure that it is working before you use it. Ensure that you are relaxed and sitting in a comfortable chair before you start. Try leaning slightly forward, using cushions to support your back. Place the funnel of the pump firmly against the breast and initiate a gentle, frequent suction. As the milk lets down, gradually increase the vacuum and reduce the speed. The nipple must be comfortable in the funnel of the pump. Some mothers need bigger or smaller funnels. The correct size gives more milk and greater comfort. Be careful that too much pressure from the pump could crack or damage the nipple, so be aware of the time spent expressing so as to avoid this happening. Putting a pump on max can cause nipple damage. The pressure control is for comfort only. The maximum setting does not get more milk out. Pumping, like breastfeeding, should not be painful if done correctly. Some breast pumps have a feature that could control the amount of pressure applied to the nipple, which helps prevent damage to the nipples. Remember to stop the process if the nipples become painful or uncomfortable. Consult with a breastfeeding consultant in this case. The breast pump should be re-sterilized before each expression. When to use the pump. Early in the morning when the breasts are fuller, or just after the first feed of the day. After a feed if the breast still feels slightly full or uncomfortable. Between feeds or at a break when you return to work. How to work out how much to express for your baby's feed. As a rough guide to give you a place to start, take your baby's weight in kilograms and multiply by 150 ml of breast milk. Then divide that over a 24-hour time frame. For example, a 5 kilogram baby multiplied by 150 ml per kilogram divided over 24 hours at 6 feeds per 24 hours equals 125 ml per feed. So remember, this is only an approximation. Every baby is different. Storage and handling of breast milk. When breast milk has been expressed, it appears to separate in the container. The milk has a blue tinge to it with a fatty layer on the top. Once the milk is swirled to mix it together, the milk looks like the familiar white color that we all know. This does not mean that the milk is old, but shows the fat content of the milk that is so necessary for your baby's health. Colostrum, which is milk expressed within 6 days of delivery, can be kept for 12 hours at a temperature of 27 to 32 degrees Celsius. For mature milk, 15 degrees for 24 hours, 19 to 22 degrees for 10 hours, or 25 degrees for 4 to 6 hours. Mature milk can be kept in the fridge at 0 to 4 degrees for 6 days. In the freezer compartment for 2 days, self-contained freezer for 3 to 4 months, deep freezer minus 19 degrees Celsius for 6 months. Freezing milk. Freshly expressed milk can be added to already frozen milk if it is cooled first and there is less fresh milk than frozen milk. After expressing the milk, allow it cool for half an hour before mixing with frozen milk so it doesn't thaw the top layer. Once the breast milk has been thawed, it can be refrigerated for up to 24 hours. Do not thaw or warm up milk in a microwave. Rather leave it to thaw at room temperature. Defrost in a fridge overnight or under warm water. Traveling with breast milk requires an insulated container and a big enough ice pack to keep it cold. Always discard milk left over at the end of a feed, so use small amounts to start with to prevent wastage.